Joy, Crystal, both of you, thank you so much for being here with us. And I understand you are both community liaisons with Intermountain Hospital. So help us understand, what exactly do you do?
So as a community liaison, we are out in the public, in the community, visiting our providers in the community, medical providers, mental health providers, schools, just making sure that they have the information they need if they encounter somebody who's in crisis, making sure they understand admission criteria for our hospital, referral process, anything along those lines. We just want to make sure they have the information they need when they need it.
Great. And give us an idea, too, of why this role in particular is so important at Intermountain Hospital.
Well, aside from just making sure that the providers are aware of who to call when they need, we are kind of the go-between for them and our providers at the hospital. If they have questions or concerns or need any information, our providers are busy with admissions, discharges, caring for our patients, so they're not always able to respond as quickly. So a provider can always reach out to me. I'm available pretty much 24/7. I have my phone with me, so they can reach out to me and I can get the information they need and get it back to them as soon as possible.
You sound like a really important touch point, right, to help as many people as possible. And what does a day look like for you guys?
Sure. We begin our day by contacting our community providers, such as the medical providers or counselors or schools or clinicians, when we have a release of information on file for a patient, so that we can help coordinate care when that patient discharges back to that provider. We also reach out to our community providers to give them resources and provide education so that they have the best information to refer their patients for the appropriate level of care.
That's great. Okay, and then two, I'm really curious to know, can a community partner refer patients directly to Intermountain Hospital without going through an emergency department?
Absolutely. We encourage that. When someone's struggling with a mental health crisis or a substance use disorder, oftentimes going to the emergency department is costly and it's not the appropriate level of care. So we encourage them to come directly to Intermountain Hospital where they can be seen by one of our experienced providers.
And is there something in particular they need to do when they come to Intermountain Hospital? Is there a specific way that it works?
No, they would just go ahead and come on in, and we would schedule them or get them in for an assessment and do a benefits check and at no cost, and determine what level of care that they would be appropriate for, whether that's our inpatient or our outpatient services.
Wow.
And primary care physicians and counselors can also help direct that care directly to us versus going to the emergency department.
Wow, that's great to hear, especially in a moment of crisis like that, right?
Yeah.
And can patients admit directly to the outpatient services even if they haven't been in inpatient service or an inpatient for Intermountain Hospital?
Absolutely. Similar to direct admissions to inpatient, our outpatient services are there for people who are struggling, who may not necessarily meet inpatient criteria, but need a little higher level of care than what they may be getting. They can call us, call our main number, and try and schedule an assessment that way. We have an online option. They can schedule an assessment online. We want to make it really easy for patients who are struggling to get in, and that outpatient services is a good option for them.
That's fantastic. Okay, ladies, thank you so much. Really reassuring to know that you're both there to help assist further and get as many people as possible the care that they need. Where can people go, though, to learn more about Intermountain Hospital?
Yeah, absolutely. They can call us at 208-377-8400. We're open 24 hours a day, 7 days a week. And our compassionate, experienced staff is willing to help anyone with the level of care that they need at the time that they call. And that's the best thing about coming directly in, is that they can be seen and appropriately dispositioned onto the units. The other wonderful thing is for outpatient services and for our New Start Center for Recovery, a patient can go online and schedule their own appointment and pick a day and time that works for them to come in. So that's another benefit.
Oh, wonderful. Fantastic. Both of you, thank you so much.
Thank you.
Thank you.